Storage and voiding are complex processes involving coordination and alteration of bladder shape. Evaluation of multiple urologic conditions involves the use of video urodynamic studies called VUDS. VUDS assesses the shape of the bladder via radiographic imaging and its function via multi-channel urodynamics. Current assessment of bladder shape is performed qualitatively based on radiographic imaging by identification of trabeculae and diverticula, which are thought to occur late in bladder dysfunction. Statistical shape analysis can be used to differentiate between clinically relevant anatomic shapes. The aims of the study were to develop a novel analytic approach for assessment of bladder shape using radiographic imaging and statistical shape modeling, and to determine what relationships exist between bladder shape and function. This was a cross-sectional pilot study with female participants undergoing VUDS as part of their clinical care. All studies were performed in the seated position. Single images representing a moderately full bladder, approximately 300 milliliters, were selected for each subject. These images were then read by two independent blinded clinicians and assessed as either normal or abnormal in radiographic appearance. The same images were subjected to statistical shape analysis by a blinded researcher. Statistical shape modeling includes multiple steps, including segmentations, shapes, calculating the corresponding points between shapes and anatomic landmarks, Procrustes analysis to remove differences due to translation, rotation, and scale, principal component analysis to calculate the variance between corresponding points, parallel analysis to determine which modes are significant, and calculation of principal component scores to perform statistics to compare patient groups. Overall, we had 22 female participants with an average age of 51 years. All were undergoing VUDS as part of clinical care, with the primary indication being severe lower urinary tract symptoms in the setting of neurogenic lower urinary tract dysfunction or previous surgery. 29% of participants had elevated PVRs of greater than 300 milliliters, and bladder imaging was radiographically normal for 62.5% of participants. All participants had abnormalities with storage or emptying as diagnosed by multi-channel urodynamics and severe lower urinary tract symptoms. Overall, 4 modes were identified representing the anatomic features of the bladder using statistical shape analysis. Mode 1 identified the lateral walls and accounted for 43% in total variance in bladder shape. Mode 2 identified the superior-inferior right walls, accounting for 19% of the total variance in bladder shape. Mode 3 identified the superior and inferior left walls, accounting for 14% of the bladder shape variance. Mode 4 identified the global roundness of the bladder, accounting for 6% of the total variance in bladder shape. Qualitative assessment of bladder modes showed separation of clinically normal, as seen here in blue, and clinically abnormal, shown here in red, appearing bladders for modes 1 and modes 3, but not for modes 2 and modes 4. T-tests revealed that mode 3, corresponding to the left superior inferior bladder walls, differed significantly for patients with clinically identified normal versus abnormal bladder shapes. Mode 1 was not significantly different in patients with radiographically normal versus abnormal bladder shapes. A subgroup analysis of participants with radiographically normal appearing bladders demonstrated a significant inverse correlation between mode 1, representing the lateral bladder walls, and post-void residual volumes. These data suggest that although not clinically determined to be abnormal in appearance, radiographically normal appearing bladders with shapes more similar to radiographically abnormal appearing bladders were more likely to be associated with increased post-void residual volumes. And radiographically normal appearing bladders with shapes less similar to radiographically abnormal appearing bladders were less likely to be associated with increased post-void residual volumes, or alternatively, more likely to be associated with decreased post-void residual volumes. Our interpretation of this is that shape analysis can be used to determine abnormalities of bladder shape similar to clinical assessment of radiographic images. Mode 3 in this study, representing the superior left aspects of the bladder wall, reflects clinical radiographic assessments of bladder shape. As clinical assessments identify trabeculations and diverticula, this mode is most associated with those features. Our study also demonstrates the ability of statistical shape analysis to detect alterations in bladder function in radiographically normal appearing bladders. In conclusion, these results indicate that statistical shape analysis can determine clinically identified abnormalities in bladder shape. Shape modeling can detect alterations in bladder shape correlated with bladder function in radiographically normal appearing bladders. And these data suggest a complex relationship between bladder function and shape. This method has the potential to identify clinically undetectable alterations in bladder shape associated with bladder dysfunction.